Hello, I'm Dr. Maurie Markman from City of Hope, and I'd like to briefly discuss, I believe, really an excellent paper, very important research, not only because of the quality of the research itself, but also because of the nature of the question that the investigators sought to explore. The paper was published in JAMA, entitled "Stepped Palliative Care for Patients with Advanced Lung Cancer." So the value of palliative care in the management of advanced cancers is clear. It's incredibly important, both in terms of quality of life, and we have actually increasing data to demonstrate it might actually improve survival with the quality of the palliative care provided in certain clinical settings. But the question comes of cost. The question comes of the necessary resources. When are they optimally employed? Is there a way to get the same value of the palliative care approach with not using as many resources, meaning that those resources could potentially be used for other patients and for other indications, for example, in the palliative care space. So this particular analysis looked at a very well-designed trial, looking at the ideas when the size that palliative care is indicated. I'm obviously oversimplifying a complex study, but randomization was patients, uh, palliative care is indicated, patients are seen, and they're seen on every visit, versus patients are seen and then they are only then seen again when their quality of life might deteriorate to the point that they would need palliative care. So is this portent, you might say, skipping or delaying sort of an intensive intervention until you document a clinical need? Does that interfere with the ultimate outcome in terms of the quality of life of those patients, is survival? And this study, particular study, again, advanced lung cancer patients, demonstrated the lack of negative effects, meaning that if one were careful, follow these patients carefully, and you employed the um, necessary, essential palliative care when a patient truly needed it as they advanced in their cancer journey, the ultimate outcome in terms of quality of life would be very similar. Now, obviously, patients will differ, but I think this is a very important look at the question. And again, I want to emphasize it's not denying patients the care, it's a benefit. It's trying to very pragmatically deal with the very real question of cost, availability of resources in the system, healthcare system. Encourage you to read this interesting and important paper, but also its emphasis on a pragmatic clinical question, trying to address that beyond the general question of, you know, what's the best drugs to give or what's the best surgery to employ? How do you optimally utilize resources that we have available to us? And I thank you for your attention.